Now let's turn to COVID-19, and the fastest spreading outbreak in the world at the moment is in India. At the moment, there are around 90,000 new cases a day. This chart shows how fast the virus has spread. Initially, India appeared to be doing reasonably well. There was a strict lockdown and numbers stayed low. But as India opened up, those numbers moved, and by August, there had been over 2 million cases. And if those are the cases, India's death toll is currently the third highest in the world at more than 80,000. We should, though, see that in the context of its huge population. In per capita terms, the virus has killed around 60 people in every million in India, whereas in Brazil and the US, the per capita rate is nearly 10 times higher. Nonetheless, there are questions for Prime Minister Narendra Modi, although he appears to be avoiding the blame so far. Divya Arya has more from Delhi.
This is a very popular government headed by a very popular prime minister. And the way the government has talked about the pandemic from the first day in the various addresses of the prime minister and his ministers is that it's a global pandemic, which kind of shields the government partly by saying that the whole world is in this together. And the people I have met over the course of my reporting in the past months have also said that the government is doing what it can because, after all, everybody is suffering. But it seems that now there is some skepticism also creeping into that, because now people are starting to question, was the lockdown and the way it was imposed a sound economic move as well as a sound move to protect their health? Because we've got last 1 million COVID cases coming in just 11 days. So the numbers are increasing and increasing at a faster pace every day. While our economy is in a very bad shape, we've got the worst figures globally, growth that is minus 23% in the last quarter. So people are saying, you're asking us to move out, you're asking us to have trust in you, but then our health is going to be at risk. So there is some skepticism about what the government has been able to do and is promising to do.
Well, Divya mentioned there it took India just 11 days to add another 1 million cases of the virus. And the growth of its outbreak has certainly outpaced the US, Brazil and Russia. You can see how in this graphic. Each row in this graphic shows how many days it took to add another 1 million cases. You can see India in red took 168 days to get to its first million. After that, as you go down, India gets to the next 1 million in the shortest number of days each time, compared with Brazil, say, in yellow, and the US in black. Well, Brahma Mukherjee shared that chart on Twitter earlier. She's an epidemiologist from the University of Michigan, and she's with us now. Thank you very much indeed for your time. How do you explain the speed at which the virus is now spreading in India?
Thank you for having me on this show. So as was mentioned, that initial lockdown really bought us time to scale up our testing, contact tracing, and healthcare infrastructure. But return from the lockdown had to be much more cautious and modulated. I feel like there is a general sense of giving up and surrendering to destiny. I do not know whether it's just habituation, desensitization, adaptation, just public fatigue, or sheer denial, or an interaction of all of these, which is leading to this recent growth. And the lockdown, with the lifting of the lockdown, there's a lot more mobility. And I also feel people are getting tired. Adherence to social distancing and mask wearing is going down, and so causing these spikes. And India is a very heterogeneous system. So some of the states coming down, but then other states are rising to boil. So it's a very hard to distinguish the national peak, because it's really a confluence of various peak or a cascade or wave of peaks.
Isn't the primary issue here, though, one we saw in Pakistan, where the Prime Minister there, Imran Khan, said, look, we could do a further lockdown, but economically this isn't viable. There are too many people living in poverty at the moment. Isn't it the same calculation in India?
I think the same considerations apply to India, and it seems like we have had worst of both the worlds, one of the biggest economic shrinkage plus the largest number of cases. And I think the one reason was that the implementation of the lockdown without proper planning led to the spread of the virus from the north and the west part of the country. Now it's to the east and the south as well. So I think it's very hard to control the virus in India unless every state comes to a state of containment now that the lockdown is over.
And do you think that's a realistic proposition? Do you think Narendra Modi has sufficient political power to bring all those states together and then bring in further restrictions? That seems like a long way from where we are now.
I completely agree with you because from the very get-go, it was really supposed to be a coordinated effort between the government, the public, and the scientists, a triad working together to defeat this insidious virus. But we did not see that long haul. I feel that everybody felt that the lockdown is a magic potion. It's going to get rid of the virus, and we did not have these strategies in place. But I'd like to mention the good thing is that the healthcare system does not seem to be overwhelmed with this large number of cases. We could actually escalate and scale up COVID treatment facilities. So the infection fatality rate and the case fatality rate both seem to be on the lower end, as you mentioned.
Brahma, thank you very much indeed. That's Brahma Mukherjee, an epidemiologist at the University of Michigan, who we saw tweeting about this issue earlier. Got in touch with her and she was good enough to join us on Outside Source.